Hello and welcome to the agenda. I am Ajay Kaul. In the agenda today, we will discuss about the declining number of active coronavirus cases and improving recovery rate. The number of active coronavirus cases in India today dropped below the 8 lakh mark for the first time in 1.5 months. The Union Health Ministry said the active case load now is only 10.70% of total positive cases and the recovery rate is 87.78%. So, is the coronavirus curve flattening finally, or is it too early to judge? We will try to find answers to such questions in the agenda today. We have with us Padma Shri Dr. M. Wali, consultant of internal medicine at Gangaram Hospital, and Dr. Vinay Agarwal, former national president of Indian Medical Association. But before we begin our conversation, let us have a look at this small report.
The COVID curve finally seems to be flattening in India. After the daily cases peaked to over 10 lakh in the middle of last month, the daily caseload today dipped to under 8 lakh for the first time in 1.5 months. According to the Union Health Ministry, the active caseload today stood at just 10.70% of total positive cases. On September 1, there were 7,85,996 daily cases in the country and were on the rise from then till September 18, when the active caseload stood at 10,17,754. After this, the numbers started dropping gradually and remained below 9 lakh per day after September 28. Today, the number of daily active cases finally came down to 7,95,087. The number of recoveries also has been increasing steadily. The government said 65,24,595 people have recovered. The recovery rate is also now at 87.78%. Experts, however, warn that it could be too early to rejoice as the number can again rise, particularly since the festival season has started. The Prime Minister Narendra Modi cautioned against complacency over the reducing number of daily cases and deaths. While reviewing COVID situation, he said people should continue to adopt appropriate distancing, self-restraint, particularly during festival season. He said 3 vaccines are in advanced stage of development in India, out of which 2 are in phase 2 and 1 in phase 3. Going by all this, a silver lining seems to be appearing as far as deadly pandemic is considered. Bureau Report.
Now, let's welcome our guests, Dr. Wali and Dr. Agarwal. Welcome to the program, sir.
Thank you.
My first question is to Dr. Vinay Agarwal. So, you must have come to know about the latest figures about coronavirus. Is the curve flattening finally?
See, reports are encouraging, but nothing can be said, Dr. Ajayji, about this. Reason is that weather is changing. We are opening up. We are thinking of opening up schools. We are thinking of festival season is coming. Pollution is increasing. With all these things, saying that the curve is flattened and the cases are reducing, maybe little early. I think that simultaneously WHO has also said that the reports are coming that there are chances that cases may increase again. So I personally feel news is good, information is very satisfying. But let us cross our hands and see if it actually takes place.
Agarwal, it is too early to judge, but is this a silver lining? Maybe there is scope for improvement.
Definitely. See, if we count with and compare with Western countries, you all know that their death rate is higher, their recovery rate is low, and if we see India, our recovery rate is better, the number of positive cases are less, and even our death rate is comparatively quite low as compared to Western countries, which are advanced countries.
Right.
So I think there is an achievement, and there is definitely a silver lining about it.
So, Dr. Wali, I will ask you now, as we count that active cases are lowering and recovery rate is improving, and now we are 87.78%. So, what does it tell you?
It tells us good things, but it also tells us that with beginning of Navratra, which I would congratulate and I would wish all your viewers a happy Navratra through your channels. And with the beginning of Navratras and the beginning of festivities, we should not be very happy. That tells me this thing. And as Prime Minister Saab has said, we should do more tests and also there is care and caution. These figures can change overnight because as pollution is increasing, as weather is getting cold, as festivities are on the way, we are going to meet and celebrate. Diwali is coming. It gives us no place to be joyous. That silver lining is important, but for a few days after that, we might have to face disaster. I'm not scaring, but I'm just cautioning. And our Prime Minister Saab, Modi Saab, has just now said a couple of days back, yesterday only, that we should be very careful. We should not be lax in using masks and we should do more tests. And that is how we can save our lives. Otherwise, after Deepavali, we might see a more dangerous form of COVID. So it is the time to be very, very careful. My message to all is that we should be very careful and we should also tell our children not to mix with elders at home and take all the precautions and three universal precautions, mask and sanitization and distance maintaining. This is my message.
Dr. Wali, as you mentioned that the government has been appealing that we have to take precaution, but as you also mentioned that the festive season has started. So, is this not the real testing time for everybody, because everybody has to contribute to reducing these numbers, isn't it?
Yes, our sir has been very kind to tell you all the data, and I fully agree with the data which is very recent. It is the time to be careful. It is the time to be indoors. It is the time to be very, very careful. Again, I am saying careful because now forearmed is forewarned. A good student is one who prepares for the exam in advance. So we have 10 days to prepare, and in 10 days we should be very, very careful, and our children especially should not be very excited. Our health services are doing the best. Our doctors are the best. But this virus is in the air. So we have to be very careful. I am again repeating this. Forgive me for this, but we have to be very
your
careful.
advice is very important. And now I'll turn to Dr. Agarwal. Dr. Agarwal, there are some people who actually say that the numbers are reducing, maybe because many people are not now coming out to go for testing, or maybe reporting is not happening appropriately. So, what do you feel on that?
No, I don't think that is the right statement, because you see now number of tests, if we see, we are doing enough tests. Maybe some states are lacking as far as number of tests are concerned. We are doing enough tests, and there is no restriction on the number of tests. Now, once that is there, so saying that because number of tests are less, that is why the positivity case is less, is not correct. We should, when we are looking at the worst situation, we should be able to appreciate the good situation also. I absolutely agree with you with your preliminary remarks that there is a flattening of the curve. The number of deaths per day are reducing. Number of positive cases per day are also reducing. And there a positivity rate and the rate of cases which are getting cured are also better. And so with this situation where the death rate is the practically minimum as far as other countries are concerned, and with our positivity rate is not to be bothered, but simultaneously the cases which are going home correctly, going home well, That is much more important. And I agree with Dr. Bali. Dr. Bali has given a very good advice. This is rather the time. We have passed two phases. One phase of the lockdown, and then we have passed second phase of the opening of the lockdown. Now, today is the phase when the situation is nearly normal, except the schools are not opening up at the moment. But the festival season is coming. Weather is changing.
Right.
With this time, we should be exactly on a situation mentally that where we were at the lockdown. We should be very careful. We should, three things which are very, very important is proper masking, social distancing, and sanitization. These three are still today are relevant as far as the cure of COVID is concerned, and they are rather the vaccines for COVID in India at the moment.
Dr. Wali, I'll ask you the same question, almost same question with a twist, because people, what I asked Dr. Agarwal was actually now people don't actually report. They all, if there are symptoms, they take their own, they do self-isolations, self-quarantine, and they don't even report. Earlier, initially there was panic and people would immediately report. Now people don't report. So is it like it is, people are now treating it like any other viral and maybe taking precautions?
This is exactly the situation in the pollution increasing, especially in metros, and weather changing. We have a very good word. Pollution creates वाहन. जैसे देवताओं के वाहन होते हैं, ऐसे ही हमारे जो पॉल्यूशन के पार्टिकल्स है, वो कोरोना वायरस का वाहन बन जाते हैं. तो हमें बहुत ध्यान रखना है पॉल्यूशन न बढ़े. और प्रधानमंत्री जी ने एक और अच्छी बात भी बताई है कि 3 वैक्सीन बहुत जल्दी आने वाले हैं, तो जनता को सिल्वर लाइनिंग में मैं और ऐड कर रहा हूं. और हाई एंड टीम्स फॉर स्पाइक इन केसेस इन 5 स्टेट्स भी डेप्यूट की गई हैं. ये जहां जहां इसका प्रकोप बढ़ रहा है वहां पे स्पेशल स्टाफ पॉल्यूशन के लिए और कोरोना के लिए लगाया गया है. और मैं बिल्कुल सही बात है हमारे डॉक्टर साहब ने जो विनय जी ने कही, विनय अग्रवाल साहब ने कही, अच्छी बात कही है. और हमारे डॉक्टर हर्षवर्धन ने भी यही कहा है कि 2 बिलियन टेस्ट पर डे कोई छोटी बात नहीं है होना. लोग आराम से कह देते हैं टेस्ट नहीं हो रहे, करा क्यों नहीं रहे हो? आप जाओ कराओ, कौन मना कर रहा है? अब ये कह देते हैं साहब टेस्ट नहीं हो रहे, क्या हो रहे तो है टेस्ट, आप जाइए तो कराने, कौन मना कर रहे हैं? अभी मैंने अपनी काम वाली के हस्बैंड को बुला के यहाँ घर बुला के लैब से बुलाकर टेस्ट कराया. कुछ इनिशिएटिव तो लीजिए, सरकार तो कर रही है, आपको भी तो कुछ करना है. डू समथिंग योरसेल्फ आल्सो. बी कोऑपरेटिव विद द स्टाफ, be cooperative with the government.
Dr. Wali, I am, yes. The question was not that people, I mean, testing facilities are not available. The question was people now take it in their stride. I mean, learning to live with it. No need to test. Maybe do self-isolation, self-quarantine, and live with it.
You are right. You are right. This speed will not go till we have a vaccine. We should not forget we are in the phase of corona. The phase has not changed. We should be happy about the curve, but at the same time careful. Dr. Vinay has just said, flattening of curve. Yes, agree. But we should not be again giving it to second wave. There are best countries in the world, in the Europe, like France, like New York. These places, there is second spike, second surge, second wave. So, we cannot afford to have second wave, frankly. So, we should be careful. If we are saying that we should be careful, there is no harm. People should be really careful.
Right.
And it is in our interest, it is in the society's interest, because once, I will tell you the reason, once somebody suffers from corona, it leaves on the body a permanent scar. So nobody would like to have permanent scar. Even if you get all right, 95% people get all right. I have just now seen a scan of a person who suffered in April. Today the scan shows changes. So why we want to become a victim of corona? When we can avoid it, when we can prevent it, when we can prevent the exposure of ourselves. So you are doing a good job. You are telling people through your program that please be away from corona, by mask, by distance, by sanitization.
Right.
So this point will remain valid till we have a vaccine, and even after that, I am going beyond vaccine. Even after that, this should be adopted as a part of culture, like our older times when Dr. Vinay Agarwal and I were students. Our teachers used to go in the wards with a wash basin type of thing, chilamchi जिसको कहते थे,
Right.
and in which there was a solution of Savlon, and the doctor will never touch another patient once he is washing carefully the hands. Our teachers have done it before us, so we are being divided about this bottle. Now, what is wrong? There is nothing wrong.
Right.
So this corona is teaching us the old adhyatm, the old hygiene which our gurus, our elders, our dharma has taught us. Same thing.
Dr.
Yeah,
Agarwal,
maybe-
Dr. Agarwal wants to
Yeah.
say something, I guess.
Yeah, Anil, you just said that probably the public is not getting the test done and they are avoiding tests, and simultaneously they are staying at home quarantine.
Yeah.
But let me remind you one thing: hospitalization they cannot avoid. The
If it
number
becomes-
of
yeah,
cases
if it
admitted
becomes
in the
serious,
hospital, yeah, the number of cases which are getting admitted and number of deaths which are happening with corona also indicators.
No, Dr. Agarwal, why I asked this question is like initially there was a lot of panic. We have seen this happening with the dengue. In the first year, there was a lot of panic and a lot of coverage and a lot of deaths and all that. Now people take it in their stride. Dengue patient goes to hospital and gets treated. So is the same thing happening with corona? People
See,
take it in their stride. That's what I'm
Finally,
saying.
the same thing has to happen. But let me tell you, there is an awareness about corona today. Now, all those patients which are just not getting their test done, getting quarantine at home or resting at home, it is about awareness.
Yeah.
But simultaneously, there is a sizable number of patients who are getting their pulse oximeter and the oxygenation tested. Once they are testing it and once they know that breathlessness is happening, they are approaching the hospital. So that is a good thing which has happened. See,
Yeah.
corona is not going to go.
Right.
Let us, it will like any other illness. We had HIV/AIDS, we had dengue, we had so many diseases happening. We swine flu. Now, similarly, corona will also be one of the diseases. Only thing, patients has to be aware.
And
vaccine
precaution.
should be available. Vaccine should be available, and higher treatment or intensive care treatment should be available to them. That is the main thing.
Right. So these are the main things, Dr. Wali. I will refer you to, since we are talking about flattening of the curve. We are seeing the rebound. I mean, the second wave in countries like Europe. I mean, the UK. We are seeing latest. Earlier, it was in Italy. So there is always a chance of a second wave, isn't it?
Actually, their traveling is not restricted much. Our country is good in a sense that international travel is still not taking place. And I fully agree with Dr. Vinay that people have become aware. Everybody has got this at the house. So many people are checking their oxygen saturation and asking me every morning that our saturation is this much, what do we do? And I will give a very good news at this time because we are winding up the program.
Yeah, please.
Second wave, I think we should not hope by taking precautions, and everybody is responsible in my country and people are educated now enough, even villagers know about it. So two good news I am giving you that the scientists have discovered that nitric oxide is found to be very effective in the ICU setting, and second is approval is given to Dr. Reddy's lab for trial of Sputnik 5. This is like a breaking news from your channel. And I would again summarize that as Dr. Vinay Agarwal has said, that corona will be part of our society. Corona will be one of the diseases as we consider in the differential diagnosis. And in this, whether dengue, malaria, typhoid, we should be very careful about any fever. Doctors should get these tests done on the day one when the patient comes, whichever tests show positive results, and they should diagnose holistically, not forgetting that they may be having corona in their patients. So if that is the approach, I think many cases will be treated early. And I tell you repeatedly that if we do a CT scan at the first go, we might detect corona even before the RT-PCR is positive. This is in my experience. I have been seeing it for last 4 or 5 months, that people are walking on the road and they have lesions in the chest and they are fresh lesions, and after 4 or 5 days they will get sick. So before they get sick, catch them young if you suspect. And second thing, I am also seeing that in one family, if one person is suffering, all 6 or 7 persons in the family are suffering milder way or a stronger way. So whole family should be careful if one person suffers. So this is my message from your channel. And again, I will repeat my profound wishes for happy Navratris.
So we are
and in Navratras, we are taught hygiene and cleanliness. So we should clean our houses from the mosquitoes. Mosquito net should be used. And Navratra gives first message of cleanliness that we should follow. And also we should remain careful about all these diseases which we have been talking, like dengue, like malaria, like typhoid, like corona. These are all our enemies equally.
So we are running out of time. Last brief comment from Mr. Dr. Agarwal. So precaution and awareness are the two key factors which everybody should keep in mind, isn't it?
Absolutely. I will repeat, Ajay, that coordination between various government agencies and the public, and again, three principles: proper masking, social distancing, and sanitization still remain valid for the treatment of corona. We have to jointly fight it out, and I am sure we will fight it out.
So Dr. Wali, you want to make some last comment?
Just one addition to Dr. Vinay Agarwal with Vinay, my Vinayful namaskar to all the viewers. And Bachardani, I have told on your channel, mask is M for Mera, A for Apna, S for Suraksha, K for Kavach. And M also stands for mosquito net. So this mask should be remembered, Mera Apna Suraksha Kavach plus Bachardani is Mera Kavach. That's all.
Thank you.
Thank you so much. So kavach should be applied all the time to be safe than sorry. Thank you both of you for participating in this.
Thank you. Thank you, Balira.
This is all in the agenda today. Thanks for watching. I'll be back with another important topic on Monday. Till then, goodbye.